Medical imaging is the silent backbone of modern medicine. Every diagnosis, every life-saving decision, it starts with an image. But what happens when AI enters the room? In this episode of The Futurist, I sit down with the team at Philips to explore how artificial intelligence is rewriting the rules of MRI, CT, and ultrasound, making scans faster, sharper, and smarter. We're catching cancers earlier, reading scans in seconds, and closing gaps in care that have existed for decades. This is where the future of medicine begins. Let's get into it. Healthcare is facing some of its biggest challenges: surging patient demand, increasing complexities in disease diagnosis, managing aging populations. These all add up to an industry under intense pressure. And what is expected to solve these issues? AI. But is the faith in this technology based on reality? While everyone is looking at AI to work out the most complex problems, think of the mind-blowing Nobel Prize-winning protein folding project. The reality is that AI offers a tremendous opportunity to help healthcare overcome these challenges and help provide access to care for everyone who needs it. In this episode, we will zoom into AI in the healthcare industry, where innovation is at the center of transforming future healthcare.
As a nurse who has been in the industry 30 years, I'm really looking forward to things moving forward. Our patients demand it, patients have been getting more complex, and we have to find a way to respond to that. We've all long talked about being data-driven and insights poor, and AI has an amazing opportunity to bring it together. And everybody as a clinician wants to come to work and feel like they've done the best job for the patient. It's going to take data, it's going to take insights and availability of that data to move the culture of our providers to see this as a real opportunity to add to that care pathway.
AI is moving so fast because it's being seen as a powerful tool to bring data. Data is gold. It's the new gold for all industries. The more data I connect, the more I can sell or get access to or see or predict in my industry. And that's across all industries. And so when you've got a tool that can connect and aggregate that much data much faster, bring results, you enhance your business, you enhance your business model, you enhance your delivery back to your patient, your constituent, doesn't matter who it is, because now the patient is also shopping. And if you can provide better data elements to them, you're now a chosen place for them to shop. So that's why AI is moving so fast. The hospitals know that it's I can help my patients, then I can help my doctors and nurses, and I can help my internal operations of a hospital move faster, better, and more efficient.
You know, we live in a very urgent time in healthcare where the need for transformation is profound. So there's a big imbalance between the demand for care as the population ages with more chronic conditions and the supply of clinicians, doctors and nurses. And so this imbalance is what Philips wanted to really study. There's a survey we do every year called the Future Health Index, and this was the 10th year. And we surveyed 1,900 clinicians and over 16,000 patients in 16 different countries to be able to understand how healthcare is being received and the impact of potentially AI on healthcare. And so one of the most interesting and key findings was how clinicians were really hopeful that artificial intelligence will help with the administrative tasks and to help them reduce their burnout and improve the way they deliver care for patients. Physicians and nurses said that they were 79% optimistic. Which means when you ask patients the same question, they were optimistic, but not as much. They were only 59% optimism. And so what you saw there in the Future Health Index was a 20% gap between the optimism among clinicians that AI would help and patients that were optimistic but not as much. And actually what was interesting is that when you actually look a little deeper, there were, in the under 45, patients under the age of 45 were twice as optimistic, 66%, and those over 45 were not as optimistic, only 33%.
In previous episodes of The Futurist, we've covered artificial intelligence and many different flavors of it. Well, let's think about it. What's the role of AI when it comes to healthcare and solving healthcare problems or enabling healthcare solutions? Well, actually quite a bit. With the advent of large language models, the ability of AI to be able to crunch a massive amount of data, things are radically changing. Modern medicine runs on visibility. Diagnostic imaging informs nearly 80% of clinical decisions in hospital care, according to the World Health Organization. Globally, more than 3 billion imaging procedures are performed every year. But imaging is no longer just about capturing pictures. It's about extracting intelligence.
Look, I do invasive procedures, and for me, artificial intelligence, AI, it's not some far-off dream. It's here, it's now, and it's already starting to give us real-world superpowers to save lives. What am I talking about? I'm talking about things like the power to diagnose and treat you faster than ever before, the power to save people in completely different countries, whether it's Connecticut, Copenhagen, or Kenya.
We are super interested in AI because it's a big transformative agent of positive change. Tell us about what is happening in AI in terms of the healthcare industry, and when do you think AI will be successful in improving people's lives?
I think we already are seeing benefits of artificial intelligence in healthcare today. For example, there are algorithms today that can monitor the heart for about 24 hours and then predict if in the next 2 weeks the patient might have a life-threatening arrhythmia. And so we're already seeing the introduction of technology that can actually have positive impact, and that's on predicting disease. Also, AI is having positive impact on access to care. We're going to have increasing more of our own personal health data on our own devices. And artificial intelligence, as you look forward, will help patients also self-manage themselves better. And so because you're with a doctor only every so often, but you're with yourself all the time. So I think we'll start to see the impact of AI also in the realm of personal care and self-care.
What about early intervention? What about radiology? How are those fields going to change with AI in place?
The field of radiology is one in which AI is critical. Like, when I was practicing, in the beginning of my practice, when I practiced as a radiologist, a CT of the brain was like 24 pictures. By the time I stopped practicing, I practiced for about 10 years, a CT of the brain was up to 2,400 images, 100-fold increase in images in the same number of minutes to read the CT of the brain. Well, today it's even more images, and so it's inconceivable to think that physicians, radiologists, can continue to have more and more images, more and more data, and the same amount of time to be able to review it all. And this is where AI is critical, absolutely critical. So for example, in the detection of lung cancer today, AI can help a radiologist identify the lung lesions easier and identify more of them that they may not have seen without it. So we're seeing AI actually make its way into the workflow of physicians and radiologists in this example, to be able to help them deliver better care for more people.
So with AI comes automation. With automation is coming agentic AI, which is very much growing right now. Help us understand the role of agentic AI in healthcare. What exactly is it?
This is an incredible era where we live in the age of intelligence, where we are able to finally put intelligence and knowledge to disk and then have software reason and do things. And when we look at artificial intelligence and agentic, we see 3 areas where it really helps advance healthcare. First is it can allow full automation of tasks which are administrative in nature and physicians shouldn't be doing anyhow. So this is full automation. In fact, this helps reduce the burnout by doing tasks that physicians shouldn't be doing anyways, having an agentic AI do it. Yeah. We also see agentic as a way of augmenting physicians and nurses to be able to do their work more effectively. I gave examples of the tools that are used in radiologists to be able to identify lesions, tumors, for example, faster. And so it's really a tool for the physicians that augments them, or the nurse. And then there's another thing agentic does in which it brings agility to a health system. What does that mean? That means because there's data being generated from patients all the time, whether they have a lab test, they have a monitor on their finger for pulse, there might be respiratory monitoring, and agents can monitor nonstop, and they can reduce the time to reaction if the data falls out of a normal parameter. And so you have automation, augmentation, and agility that agents bring. Of course, any AI tool that's deployed, you have to always be monitoring for adverse events. And so you always want to have human oversight to make sure that the agents are acting in a way which is acceptable to the way in which care should be delivered.
As more data is generated, more maybe analysis is required, more mental and energy needs to be spent. But what about shortages? There's also a huge shortage of qualified staff everywhere across the world. Can AI help somehow?
Today, the statistics is 66% of physicians are experiencing burnout. And in fact, in that Future Health Index, there was a really interesting finding in that we asked clinicians, look, generally speaking, compared to 5 years ago, are you doing more administrative non-clinical tasks, the same or less? Because as an industry, what have we done for you?
Yeah.
And you know what was really surprising and maybe even sad was that 45% of clinicians said, look, I spend as much time on administrative tasks today as I did 5 years ago. And what's even more shocking is 35%, 1 in 3 said, I spend more time administrative tasks today than I did 5 years ago. So as an industry, we have a ways to go to be able to take that away and the administrative, the non-clinical tasks away. So this is where AI can really lean in. Artificial intelligence through that automation can take away the non-clinical administrative tasks and help the physicians get the joy back, why they really went into medicine is to spend time with patients. In fact, the Future Health Index, over 80% said, look, we believe AI will help give us more face-to-face time with patients by taking away the administrative tasks. Yeah. So there is incredible hope. Our track record as an industry is not where it should be, but when you look ahead in this age of intelligence, I believe we can finally achieve what we promise clinicians, in that help them deliver better care for more people and reduce their cognitive load.
Now, AI is going to have a tremendous impact both on patients as well as on physicians. Now, both of them get the benefits from technology changing how outcomes are delivered. For physicians, automation, the ability to come up with faster decisions, faster diagnosis is massively important when it comes to be able to diagnose a patient and to deliver the right treatments. Philips reported in its annual report recently that AI is integrated across more than half of its diagnostic imaging portfolio. AI-powered MRI acceleration technologies have demonstrated scan time reductions of up to 50%. Shorter scans mean greater patient comfort. Smarter workflows mean greater efficiency. The image is no longer isolated. It becomes part of a connected ecosystem.
In stroke, AI is already coming to the rescue. Now let's talk about stroke. You know, 1 in 4 of us over the age of 25, that's you and me, 1 in 4 of us will have a stroke at some point in our lives. And with stroke, seconds count. Time is literally brain. Every second that you go without treatment, it's It's kind of like deleting parts of your hard drive, losing memories, losing speech, losing function. But artificial intelligence is already helping us to spot the tiniest clots that cause these strokes. Now, you may not know this, but there's a huge connection between the heart and the mind, and not just in the figurative sense. There's one type of heart irregularity, and it's called atrial fibrillation. And left untreated, it can cause a stroke. So the more precisely that we can see inside of your heart, the more precise our treatment can be. This device, it gives us a real-time 3D view inside your heart using a special kind of ultrasound. It shows us your cardiac chambers, it shows us your valves, it shows us your soft tissues. And we can combine this with X-ray, all on the same screen. And that helps us guide these amazing new miniature devices that are used to repair heart abnormalities. All of these tools working together, and they help us to do things like replace heart valves without open heart surgery, through tiny incisions only a few millimeters in size. We're not just curing faster, we're preventing the need for major surgery. And in the next several years, these rooms are going to become even more intelligent, combining artificial intelligence, augmented reality, voice control, eye tracking, even robotics and automation, new ways of imaging without any X-ray, and enabling new devices to treat you without major surgery, so that we'll be able to operate faster and even more precisely than ever before.
Digital pathology is not just a tool, it's a platform. And we have been very lucky to have Philips as colleagues and partners in this journey of developing digital pathology from the very early origins of scanners to what is today, a platform in which the slides that we scan can be part of the cloud, can be part of an entire new armamentarium, not only for diagnostic tools, but as we keep applying also artificial intelligence tools to enable the pathologists to be better pathologists. We are opening a new door in the history of diagnostics. The pathologies are more efficient. The images are being able now to produce knowledge, and we can manage this knowledge in order to better manage our patients. So from the point of view of a new platform of efficiencies, of efficacies, and being able to render these diagnostic and predictive tools into the community at large, it's definitely a new momentum in the area of diagnostics.
Mount Sinai and Philips together have been working on this platform, which in the area of breast and prostate, Mount Sinai has made incredible strides and advances in advancing care for breast cancer and prostate cancer, and digital pathology has helped advance that as well. Could you tell us a bit about those programs and how digital pathology has helped advance care for people?
Absolutely. Pathology is essentially do in cancer two major impacting results. The first one is to assess benign versus malignant. And once the tumor is a malignant tumor, in some of the tumor types, we need to give a grade. And the grade includes the prediction, the grade includes the prognosis, the grade includes specific potential targets. Digital pathology is allowing us is to take that grading that was relatively subjective and dogmatic into something that is pragmatic and objectivable. So we are not only using the expertise of somebody looking at an image, but the biology and the quantification and the algorithms that make it much more robust. And this is one of the major advantages of bringing all of this together into a single paradigm of diagnosis, which is now augmented by precision and by identifying targets.
So if you have to simplify for folks, combination of digital pathology and AI, how does that help deliver better care for more people? How does that improve care delivery?
It will improve care delivery because, first of all, it's more efficient, the turnaround time is faster, but also it combines not only the observation and what we have learned about the microanatomy, but also what we are learning about the biology and the genetics, and bringing it all together in a single moment as a unit for diagnosis and prediction, it's absolutely what I believe is going to be the trend into the future.
In surgery specifically, there are many elements of AI that come into play. For example, when looking at even planning a surgery, and let's talk about a complex surgery, for example, separating conjoined twins, or a surgery that requires a very complex execution.
The global economic burden of cardiovascular disease exceeds 1 trillion per year. Prevention is no longer theoretical, it's data-driven. Physicians spend nearly 2 hours on electronic records for every hour of patient care. Burnout rates remain nearly 50%. Early deployments of ambient AI documentation tools show reductions in documentation time of 30 to 50%. This is not just efficiency, it is restoring time to medicine.
Surgery goes back thousands of years, and for almost all of that time, it required us to open you up to see inside of you. But now, thanks to imaging that we've developed, we can see inside of you without opening you up, using things like CT scans and MRIs, ultrasounds, X-ray. So when we say image-guided therapy, that's the imaging. But that's just half of the equation. The other half of the equation is the therapy. Not only can we see inside of you, but we also have access to miniature devices, things like angioplasty balloons, laser fibers, vascular implants that I can guide and navigate through your body without opening up to treat you. And what we're doing is we're integrating the imaging to the therapy, and that's why we call it image-guided therapy. 1 in 10 people undergo a surgical procedure every single year. So that means in the next 10 years, you, me, somebody we know is going to need a surgical procedure. And increasingly, it's going to take place just like in this room that you're looking at. It's things like opening up blocked arteries in your heart, replacing cardiac valves. We can kill tumors in your liver or in your kidney or in your lung. We can open up blocked veins and arteries in your leg, preventing amputation. We can even extract little tiny clots, not much bigger than a grain of rice, that cause a stroke in your brain. And the magic is we do all of these procedures using little tiny catheters, not much larger than a pencil point, a piece of spaghetti. So that means when we're done, people can go home from the hospital, sometimes the next day or even the same day with just a Band-Aid. It's pretty incredible that you can do all these procedures so minimally invasively, and this is only going to expand.
AI is already being used today to help us diagnose you faster than ever. Let me give you a couple of examples. With MRI, we already had AI embedded into our MRI scanners. It's allowing us to scan you 3 times faster than we were in the past. And at the same time, it's improving the image quality by over 65%. So what does that mean? If you're a patient, it means you don't have to lay in that scanner for as long. It's a faster scan. If you're a radiologist, you have a much better image quality, making the diagnosis much easier. And if you're a government or a society, just imagine all of that backlog to get into the scanner. Now we can get the throughput even faster. AI is also helping us reduce your X-ray dose by over 80% in some CAT scans. Also, it's helping us have a better look at your heart. Just imagine your heart's beating and artificial intelligence is now giving us motion compensation so we can see your coronary arteries better than ever. We even have AI-powered cameras built into our scanners, helping technologists get you on and off that table faster than ever. AI is making us much more efficient, but AI is also helping us diagnose. We already are starting to see the first artificial intelligence applications embedded into our scanners. Think about things like AI for prostate cancer, where it automatically looks at the images and segments out areas of suspicion, helping radiologists decide whether or not a spot in your prostate just needs to be followed or if it needs a surgical biopsy.
With all this incredible innovation taking place with AI and of course other technologies, the future is really looking different. Faster care, better diagnosis, less burnout in the healthcare industry, and really looking at people living a better quality, a higher quality of life, no matter where they are. Diagnosis, medical imaging, And treatments across the board within the healthcare industry are changing because of AI. From drug discovery all the way to living a longer life, AI is definitely impacting the life of everyone here.
We simply do not have enough physicians, enough staff to perform all of these complex procedures. But I think augmented reality, AR, it's going to help us bridge that gap. You can virtually beam in people for training today, and maybe even to help during procedures in the future. And thanks to AR, it's kind of like we're standing right next to each other, shoulder to shoulder. Maybe I can guide you through a complex procedure from the room next door or even continents away. We can overlay vital patient data or anatomical structures directly onto your view. Now, this isn't just a video call. This is real-time, interactive, bionic mentorship. And it means we can rapidly train more people more effectively and connect global expertise to anyone, anywhere. AI is not just about hospitals and operating rooms. Artificial intelligence is delivering superpowers where I think it's needed most. It's improving access to basic healthcare, especially in critical areas like pregnancy and childbirth. The risks that cause things like maternal hemorrhage, they can be readily picked up during ultrasound scans that one should be getting during pregnancy. But all of those prenatal ultrasounds, they're not available everywhere. Just think about the heavy equipment, the expensive equipment, the trained physicians, the technologists that are needed to scan the patient. So the solution isn't so simple. It's not just sending more ultrasound machines, because you still need trained experts to operate and interpret the scans. And that could take months or even years to train them. But the good news is this is where AI can step in. This is a prototype that we're developing with the Gates Foundation. It's super simple. It runs on a tablet. It uses a miniature ultrasound probe. It doesn't even need the internet. You follow lines on the screen, and if you're doing it properly, it tells you you're green and turns red if you need to adjust your scan. And using sophisticated AI, in just seconds, it analyzes all of that data from your ultrasound sweeps, and it alerts the local caregiver if the mother's going to be at risk for complications like hemorrhage during delivery. It's turning months of training into just a few hours. Now, this prototype, it's already helping midwives in Kenya save lives, and soon it'll reach even more places. That's AI giving life-saving superpowers to everyone, no matter where they are.
What about the future of healthcare provision? What about doctors? Will we still have doctors in the future? Will AI replace doctors?
We are at a point in history right now with such shortage of clinicians, such an imbalance between supply and demand, and such burnout. And physicians are working nights and weekends. It's called pajama time.
Yep.
They finish their work in the evening after dinner. They finish their work Sundays before they go to work on Mondays. And so we are in a crisis of shortage of clinicians. We need to give them AI tools so they can get back to regular life and to get the joy of their practice back. And so I do not believe that AI is going to replace physicians. If anything, it will give them the tools to take away the things they shouldn't be doing and focus more on patients. And so this is the direction, I believe, for decade to come, that AI will simply allow the needle to come back to moderation so that the clinicians don't have such burnout.
The world, it's moving at warp speed. And Gen Z, they're already embracing AI in healthcare. But there's also Gen Alpha. Those are the kids that are born since 2012, and they're our first true digital natives. But guess what? 2025, it welcomed a brand new generation. We call it Generation Beta. These are the first generation of kids that were born into AI-powered healthcare. It's all they will ever know. So hold on to your seats. The future of healthcare, it's not just bright, it's blindingly brilliant. And by the time the Generation Beta kids grow up, these superpowers, it's going to be their amazing everyday reality.